Continue here now. South Africa's COVID-19 test positivity rate has risen to over 31%. 8,524 new infections were reported in the latest 24-hour reporting cycle. 11 new deaths have also been reported, with 5 of them occurring during the latest reporting cycle. That takes the death toll to 100,516. Higher Education and Training HIV and AIDS program Higher Health is urging students and staff who are now returning to campuses, residences, offices and other indoor congregation settings across the post-school education sector to be cautious. This follows an increase in COVID-19 cases in the country. The spike is associated with the current predominant COVID Omicron subvariants. The symptoms include sneezing, nasal congestion, sore throat, cough and fatigue. Now, for more on this, Professor Ramneek Ahluwalia joins us to weigh in on the increase in cases of COVID-19 looking at higher education institutions. Prof, thank you so much for your time this afternoon.
No, good afternoon, Unati, and good afternoon to everyone. Thank you.
Take us through the changes and the concerns that you have and are currently seeing as Higher Health in terms of the spike in cases that we are now seeing. I mean, some saying that most of the provinces could potentially be already in the 5th wave.
Definitely, Unati. There are some multiple factors that are happening together at the same time, for which we're seeing this major blip. Probably the start of the 5th wave, or we already in 5th wave in few provinces as I speak to you. Now, the factors that are happening together is, the first one is the behavior change. We've just come out of a festive season, a lot of socialization, a lot of people mingling together. And that exactly happens when a festive season just happens, and April was one of those seasons. Students were home, young people were home, they were partying, they were mingling together. And parallelly, at the same time, the weather started changing, which means the cold weather came in. When the cold weather came in with this whole climate change, we've never seen Aprils the way it's been in South Africa for now, is the fact that people are indoors. And that's exactly what the virus is enjoying, which is the free flow, because you are in a closed indoor congregations and with less ventilation, being an airborne disease, a very fast spread, and specifically when you are in crowded places. And thirdly, at the same time, what you are seeing is that we had a national state of disaster removed, which obviously allowed people to not wear masks, and mask wearing was compulsory, which obviously has a huge bearing specifically in indoor congregations, because mask still protects a lot of airborne transmission if you are in a closed, less ventilated congregation, specifically in airborne. And lastly, at the same time, the Omicron variant, which was very visible in the world globally, in South Africa, found this nice aptitude of festive season, and it's mutating. That's a viral evolution. Each virus, whether it's its offspring or whether it's a new variant or it's an old variant, is continuously trying to mutate. And this, surprisingly, a subvariant called the BA4 and the BA5 of the original Omicron that existed in South Africa, it's just happened to be the 4th wave finishing at that moment, mutated so well that it formed its 3 classic features that defines us moving into a wave, which is it increases transmissibility, which means it has better transmissible power than its previous offspring, or the BA1 or BA2, so it changes shape very well. Secondly, it started having what we are always worried, called the immune evading system, which means when it enters our body, our immune system is not able to recognize it. It remains invisible.
Professor, just, taking from what you're saying and also looking at the test positivity rate, which is sitting at over 31%, that is of concern. So the question then is, has vaccination programs been prioritized in higher institutions? Are you vaccinating enough students and supporting staff so that, because what is of concern is that we are seeing these numbers increasing and also hospitalizations increasing?
So as we've seen, that vaccination has been very low in young people. On the contrary, higher education through immense work done both by universities, higher health, and many formulation bodies. We've seen approximately 62%, that's our ground survey, that shows 62% of our student community and staff are vaccinated completely or in the vaccination program, which means they will complete the vaccination process. We also see the same time the first years are coming in this period, which is this year, which means we have to still again continuously put the emphasis of vaccination, because what we know clearly is that vaccination holds its guard towards severity of the disease or deaths. And in no way, even if I am saying we are entering the fifth wave, there's no panic. Why? Because lots and lots of population either vaccinated or have an acquired immunity, which they got through getting COVID-19 in the past, and Omicron being less virulent is factoring towards less severity of the infection. So vaccination is critical, and not only critical that higher health or the institutions of higher learning needs to continuously promote, not for the fresh year, the new students coming in to get vaccinated or non-vaccinated people to get vaccinated, but also the boosters, which are very critical timelessly to be given, because we've seen that our natural immune system weans off, and that's a natural phenomenon which needs to be boosted in time through these boosting vaccination probabilities. So this project of vaccination is critical, remains one of the formidable or known factors, both not only for preventing the spread of the virus, now studies have shown that too, but also the severity of the disease. So it's an absolute needed affair at this moment.
Now, we know that the mandatory vaccination at institutions of higher learning has been condemned by various associations, but we're also hearing reports that there have been some students and staff members who have allegedly been forced to vaccinate in some institutions, even though this is the case. You know, if they're not vaccinated, they could not sit, for instance, in exams or enter some premises. You know, how are you ensuring that you promote vaccination for enough students and also workers without compromising on anyone's individual right?
So as a sector, as a post-school education sector, where we've got universities, both rural and urban, we've got technical colleges, we've got community colleges, we've got private higher education institutions, I'm talking collectively, the aim is, in one voice, is to ensure that, including student leadership or university leadership or union leadership, that vaccination plays a very central role towards preventing the COVID-19 or protecting human lives. So the vaccine promotion remains a central figure of the unanimous decision of the sector together. Now, the mandatory vaccination process is not something that we have moved with, because we are moving in the process called not leaving any student behind or not leaving any staff behind, which means that if you are not vaccinated, if you just join as the first year, you still have full access to education. The question is, when you are in indoor setting, in the laboratory, in libraries, in classroom where congregation is an indoor, that is where we are looking into at a very with a close proximity, because when you are bringing vaccinated people together, the transmission of the virus, as much it happens, but the severity of the disease means you're protecting individuals from dying or severity. While education on a hybrid model for both online and access to education on-site still remains as a parallel figure to give education as a priority to everyone. So at this moment, the aim is as much, so as I said, 62% of our student population is vaccinated, which means the remaining 38%, we are going to continuously strive towards getting them vaccinated so that they are also able to enjoy all the benefits, if not few that have been remaining. But access to education remains irrespective of you're vaccinated or not vaccinated.
I got you, Prof. Thank you so much for that update, Professor. Thank you so much for joining us on the show.